This is Crystal Phend with MedPage Today here in Gothenburg, Sweden at the Heart Failure Congress, where researchers have reported results of a survey on European use of cardiac resynchronization therapy devices. I spoke with Dr. Kenneth Dickstein of the University of Bergen, who presented the results here.
We know that there's guidelines which have limited evidence and a lot of patient populations, and we know that there are many patients who are being implanted essentially off-label with newer indications. So we included 2,450 patients, 13 countries, 141 centers, and I would say that the most important finding was that clinicians are implanting patients who are older, far older than in the randomized clinical trials. Many patients, a quarter of the patients, are in atrial fibrillation, and none of the trials has included that patient population. The QRS complexes are much narrower than as recommended in the guidelines, and many of the patients, for example, over 9% are under 120 milliseconds. And then the presentation I gave today was that almost a fourth of the patients are actually being upgraded from a previous device, either a permanent pacemaker or ICD.
But upgrades didn't appear to put patients at a disadvantage, as Dr. Dickstein explained.
There was essentially no important differences. Obviously, there were many minor differences, but there were no important differences in the demographics of the patients, in the procedural details, in the complication rates, or in the clinical outcomes during the follow-up period, which was on average approximately 1 year, from 9 to 15 months. And that's important. There's limitations. This was a survey in which we included consecutive but successful implantations. So we have no information on patients that were screened and not implanted or unsuccessful attempts. So that would certainly give us a certain degree of bias in the survey, but that's the nature of surveys. Surveys give us information which is complementary to randomized clinical trials. They demonstrate the extent of penetration of the guidelines and the extent of experimentation with wider indications, which I think for me was the real eye-opener from the survey and very encouraging.
So reassuring results for patients who need a device upgrade. In Gothenburg at the Heart Failure Congress, I'm Crystal Phend, MedPage Today.